10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
So, how important is your primary care doctor regarding your health care? Are they somebody you see maybe once a week, once a month, or maybe even once or twice a year and that's it? You know, the primary care doctor lately has been someone who is coordinating all of your care. They're taking care of the prescriptions. They're making sure the specialists are ordering the right lab tests and making sure that overall you get the right treatment for your care. Whenever you need that urgent care ER situation, they're the ones you always come back to make sure that overall your wellness is taken care of. Lately, we've had a shortage of primary care doctors. Renown Medical Group has actually been helping with this shortage by opening up new facilities here in town. Today, I'm talking with one of those doctors at the facilities, Dr. Shruti Basho. She's going to be talking about all of that, all the new facility has to offer, all she has to offer, and some of the care that she sees on a regular basis. And she'll be actually getting that to you through this video, through YouTube Live. Now today we're going to be presenting this on YouTube Live, specifically so that you can participate in this discussion. If you're not subscribed to our channel, please subscribe to our channel. That way you can be notified when we go live and when we have these discussions with doctors and other medical professionals here in town. Now, beginning actually on the 15th of this month, September 15th, we're going to be starting our second series of videos called Hello Health. It's a separate series called Mastering Medicare. Now, Mastering Medicare has to do with specific Medicare plans that are out there that are available to you for 2022. So you'll be sure to be notified of that if you subscribe to our channel. So please subscribe. Also, if this video was helpful, we want to make sure that you like the video. That way we show some support. We're obviously a local company here in town, so we need that support in order to thrive and help produce more of these videos for you. Now, I'm from Health Benefits Associates. I help people connect with medical providers. And so whether that's through the insurance companies we broker for and we help you get, or whether that's through these introductions with the doctors and medical professionals, we want to help connect Northern Nevadans with the care that they need. So today I'm talking with Dr. Basho. She's going to be talking about the Renown Clinic and the different options and different care that she gives at that clinic. During her more than 20-year career as a physician, Dr. Basho has been many things. She has been director of OBGYN and faculty at a Family Medicine Residency Program in Cincinnati, Ohio. She also worked at an underserved primary care clinic while in Ohio. She has called Reno, Nevada home for the last 13 years. And has been with Renown since her move to the Silver State. She is currently a primary care clinic at the renowned Monte Senior Care Plus Clinic, where she is delivering patient-centered and detail-oriented primary care. Now, Dr. Basho, are you on the line?
I am. Good morning, Alex.
Good morning. Perfect. Well, we've got a couple of questions for you. I've got a couple actually myself that I wanted to start with, but while we wait for other people to ask questions, I do want to get a few to you. But as a viewer, if you're viewing today, feel free, now's the time, type in your question. I'll be the moderator here, and I'll be asking as we go along. Now, just a couple of questions for you. Tell me about the new clinic and your specific role there.
So the new clinic off of Del Monte, 740 Del Monte Lane, opened up in January, and I've been there since opening. It's a brand new clinic, and it's exclusively for our Senior Care Plus members and patients. We have a beautiful lobby. It doesn't even feel like a doctor's office when you go there. Our exam rooms are larger. We have specialized exam chairs, and the lighting is different there too. It's really geared towards seniors.
Yeah.
We have 5 providers over there, including myself, and we have multilingual staff. Um, our doctors speak several different languages.
Yeah, perfect.
And I encourage you to stop by and say hello. Check us out.
Absolutely, absolutely. So for Senior Care Plus members, you mentioned you had 5 doctors in that clinic. I mean, are any of those specialists, or if they're not specialists, what's the kind of goal of the clinic? Is more primary care focused? Am I understanding that right?
You are. It is primary care focused. So we only do primary care at the clinic. We have 5 providers, 4 physicians, and 1 nurse practitioner over there, total of 5. And, we're part of the Renown medical group. And so even though you're coming over and it is a primary care clinic, we have access to the complete Renown medical group. And by that, I mean the cardiologist, the pulmonologist, anybody that is under the umbrella of the Renown medical group.
And that's so important because as one of, if not the largest medical group here in town, I mean, to be able to rely back onto those resources and have one integrated system where they can get care. I mean, I've seen it work so smoothly, and if you actually do it the right way, if patients are able to coordinate that care through a primary care doctor, like Senior Care Plus members have, they actually get great care and they end up working the system very well.
Yes, no, I completely agree. And I don't know about you, Alex, but I'm a big football fan, so go Niners. What I like to tell my patients is that I am their quarterback in the clinic. And so if they see any specialists, if they go to urgent care, if they've been hospitalized, I want to know everything. That way I can coordinate their care and keep them healthy.
It's so important to prevent that future hospitalization. I mean, I've seen that so much, especially with COVID happening, is that people put off that primary care visit. They didn't treat those minor conditions while they were minor, and now they've turned into monsters that they just can't hide anymore. And it's sad to see. And so important that primary care doctor that is, by the way, one of the most affordable doctors on a Senior Care Plus plan. They can prevent that hospitalization, which is unfortunately one of the most expensive things on any Medicare plan. And so financially and physically, just so much better to come in and see you more often.
I completely agree. And our clinic also offers telehealth. So we do telemedicine visits from the comfort of your home.
Perfect. Yeah. And that's so important to have that telemedicine that's in town, and you're not getting the 1-800 number. I mean, it's not bad to have it, especially if you're traveling. If it's a national company, it's not terrible. But to have it with some doctor that you have met face to face, it is a little bit different as far as the feel, and probably different for the patients. They're able to tell you more about their personal condition. They feel a little more comfortable with you, and so I mean, I can imagine that's probably a huge difference.
It is, and it also, when I do these telemedicine visits, it gives me a little insight into their house, their living situation. And these are things that I may or may not know when they come to see me in the office.
Good to know. Yeah, absolutely. I do have a couple questions that came in. One from Katie. She says, does the Senior Care Plus clinic on Kiski include specialty care? I think we answered that. I think I inadvertently answered that just now. It does not, but you are the quarterbacks for that specialty care that they can receive through that clinic. Is that right? So they go to the clinic, get that referral?
You are correct. I can place the referrals, and many times I can even do an electronic consult. So if we have a question about a cardiac medication or a kidney medication that's been prescribed to you by your specialist, I can send them an email. I can pick up the phone and give them a call and have an answer right away.
Yeah, so important. And I know that having these doctors available, one of the huge advantages of having one of the largest medical group here in town is to be able to get into that doctor. I know lately it's been kind of tough getting into doctors for a lot of these seniors. So this dedicated clinic for Senior Care Plus members, I mean, I can't tell you how many seniors I've talked to that have made that the critical decision between choosing a Senior Care Plus plan and choosing something else, because they can't get in to see doctors. It doesn't matter how much they pay for the most expensive Medicare plan they can get. If they can't see doctors, what's the point? What's the point of having the insurance?
Yeah. So, well, all 5 of us are accepting new patients.
Perfect. Awesome. Well, good to hear. That's great to hear. I have another question here from Jimmy. I have an AARP and want to schedule an appointment. Can I come see you? So this clinic is dedicated for Senior Care Plus members. Is that right?
That is correct.
Perfect. Yeah. And so on that AARP plan, I mean, I would be glad, Jimmy, if you contact me after this to show you different plans that work with AARP, or to show you how that compares to the Senior Care Plus plan. Open enrollment for Medicare Advantage plans is actually coming up this October 15th to December 7th. And so that's a great time to shop, to compare AARP versus Senior Care Plus or any of the other options that are out there. And so that's kind of, I guess that was a question more for me because I can help compare that to the other options that will work with Dr. Basho here. And here we have Robert saying, I love Renown. Can you open more offices? The wait times are so long. So I know that you're not on the administrative side, but I know that you just opened this office. So how long ago was it opened?
We opened in January of this year.
January of this year. Wow. Okay.
Yes.
Yeah, that was right away. So it sounds like that Renown is actively opening these offices, and at least they have this year already. I don't know, looking in the crystal ball, I know you're not the administrator over there. Neither am I, obviously. But it is good to see that Renown is actively opening these offices. I will actually ask, and I'll follow up in the comment section below here with that additional answer. I'll ask the senior leadership over at Renown and see if they have any plans to open any additional facilities. I know they just opened yours, and so in my mind, they're expanding along with the population of Northern Nevada.
I would think so, yes. We have seen such a growth, and we are busy. And I think, Robert, you mentioned the wait time. I don't know if you meant the wait time once you come to the offices, but, we've got procedures in place in our lobby. That way, no matter how beautiful our lobby is, you're not spending your time out in the lobby waiting for your doctor. Almost all your time is spent back in the exam room with the physicians.
Yeah, and that is important. I mean, to be able to, and I know that these facilities in general are an attempt to help free that up, to help free up those wait times, to help free up those doctors, and not just doctors. They're great nurse practitioners, physician's assistant, registered nurses. They're great medical professionals. It takes a team, really, and I know that you're one of them, but I wouldn't discount any of the providers that are over with Renown. I think that they've got a great team over there, and I've heard great things about everyone, not doctors as well as those without the MD.
Nah, you nailed it. We are a team.
Yeah, absolutely. Well, let me get another question here. Here's from Katie. This is great. Do you help with diabetes? I am type 2.
Oh, definitely. Yes.
And so what are the most frequent conditions you're seeing here for Northern Nevadans? And diabetes kind of is something that I see all the time. People need their diabetes medication covered by their insurance plan, and that's obvious. But what are the kind of common conditions, not to say you're going to diagnose anybody on the show, but what are the common conditions that you're seeing, and are you seeing something is more preventable than another? I know right now with all the smoke in town, I bet you're seeing a lot of cardiac issues, not to count the obvious COVID coming in.
Right, the respiratory issues as well. I am a family medicine trained physician, so I do see a lot of diabetes, a lot of asthma, COPD, with a lot of hypertension. I see everything. We see everything. Family medicine physicians are trained. I've delivered babies. I've taken care of pediatrics. I've taken care of young adults. And now I'm at the Senior Care Plus clinic. So we're capable of doing everything. And you mentioned COVID. We have a laboratory in our office. And so we're able to test for COVID over there as well.
Wow. Okay. So you can do the blood work right there in your office without people having to go get that secondary appointment. Is that right?
That is absolutely correct.
Wow.
And that's one of the things I love about this new office.
Yeah, that is big. That is huge, because a lot of people might not know, because they might not go in and get regular blood work done, but that is a must for a lot of seniors that I talk to. Regular blood work it's part of preventative care, by the way. So for insurance purposes, a lot of blood work services are billed as a preventative service, that's going to be no copay. It's required by the Affordable Care Act to be no copay on those plans. And so that's really important. Not only that, you've got the full lab right there, so you don't need to make a second appointment at a separate facility, go drive, go, not that that would be that difficult, but it still is just one less step, making things easier.
Yes. No, our patients seem to love that. And it's very convenient. If I've got somebody in there and they describe symptoms of diabetes to me, I just walk them to the next room where the laboratory is. Yeah. And we'll know right away if it's something that we need to deal with or not. So.
Yeah. Well, the next question here from Jimmy, actually, I draw this, I have a lot of patients that draw this connection here, so I'm going to ask this one. I'm confused. Is Renown like Kaiser? I heard Renown wants to be like Kaiser. I can answer that from an insurance perspective. Maybe you can help it out from the provider's perspective. From an insurance perspective, I'm seeing that Renown is moving towards that Kaiser model, but I'd say it's very different because the Bay Area is gigantic. And Kaiser, the amount of patients that they serve and the amount of services that they do, they've maybe over streamlined the patient care. And they don't have that personal touch that we continue to have here in Northern Nevada, where you have a provider that wants to reach out to you, such as Dr. Basho here, who actually takes the time, takes you down in the office, sits you down, looks you in the eyes, and asks you how you're doing. I think that was a little bit different. I was on Kaiser actually in California. I felt like it was different. I don't know if that's the experience everybody has, but not to say anything bad about Kaiser, but I think that it is a different experience. It's a different medical group here in Northern Nevada. What are you seeing from the provider side as far as, do you see any differences, or do you have an experience with Kaiser at all?
I do. I grew up in the Bay Area, so
yeah.
I'm a Kaiser child.
Got it. Okay.
I think what we have in common is that, both groups aim to provide value in their medical care. We are small enough where, as you mentioned, you do get that individualized, focused care. And we're trying to be like Kaiser in the sense that we have a medical group. We have the cardiologist, we have the pulmonologist. And so this is above my level, Jimmy. I'm not an administrator, but what I see happening is that we're trying to get the best of Kaiser into the Renown Medical Group. Yeah. We're not trying to become Kaiser, if that makes sense.
Absolutely. And I mean, you talked a little bit, and we talked separately a little bit about the Renown's technological capabilities, and I thought that was something that was just absolutely above and beyond what we're seeing from a lot of other companies, as far as being able, as a provider, to enter information in and have the patients have their lab results right away. Can you speak a little bit about that?
Yes. I think you're talking about the MyChart access, the computer access with the lab test results. Yes. So everybody I know who has it loves it. And if you don't have it and you're a Senior Care Plus member, I encourage you to get it. So the online access, the MyChart, it allows you access to receiving your lab results, your imaging results online. If you have a question, if you would like an appointment, it allows you to send a message directly to your doctor's office. And, many times we get to it right away.
Yeah.
So,
and that's great.
If you need a referral, if you need refills, anything. And I have a teenager at home who helped me set up that at home, but he's helped his grandparents with that as well.
Yeah, and I mean, that kind of access, just to be able to see it, a lot of people, the only time they have to get on there and check it is after work, maybe in the evening, or maybe at night, or maybe on the weekends, or whatever it happens to be. And to be able to access that and to see it right there, even if they can't answer that text or that cell phone call or what have you, to be able to still have that connection with the provider, I mean, it's huge. It's a game changer, and I think it actually is significant in helping people live better lives and be healthier. And so that I can't stress it enough. I've heard a lot of good feedback about it from people I've talked to, and so I encourage you, if you are a Senior Care Plus member, to go on and register an account if you haven't already. But half the people I'm talking to, hopefully more than half, have already registered an account, and I'm preaching to the choir, so it's good to hear. I've got one more. Let's see if I can't get one other here. Keep it coming. So you said you do treat diabetes as well as other conditions there. And how often are you seeing patients? I mean, how many patients do you normally you see? You see quite a few a day. You brought a lot over from your prior experience in your prior medical facilities, and now you're continuing to see those patients as well as you're scheduling new appointments. So that's all great to hear.
Thank you. Yes, I was previously with Renown at the Vista clinic off of Vista and Reno. And so many of my patients were able to follow me over here with the Senior Care Plus insurance. And I'm grateful for them to be driving all the way down here to see me. So thank you. But it really depends on your medical history. That determines how often we see you. If I need to see you every other day, I'll be happy to do that. If I need to see you next week because you have an infection and I want to make sure it's getting better, I'll have you come in. If I'm not there, I'll have my nurse take a look at it. But we individualize the treatment to the patient.
Yes, of course. Perfect. Okay, great. Well, Dr. Basho, I think that we're going to wrap up pretty soon here. If we didn't get to your question, I really do apologize. We will get to your questions. I will answer those personally or email the doctor here and get those answered for you. And I can't thank you enough for participating, Dr. Basho. It was so nice to have you. And thank you for your time. I want to be really respectful of your time because I know that you are a busy person. So I appreciate it. Thank you for coming on, and we'd love to have you back.
Thank you so much, Alex. Take care.
Perfect. So, hey, thank you so much for attending today's presentation. We are going to be putting on live seminars here in the next couple months. And so we're going to be putting those on in Reno, Sparks, and in Carson City. And so if you haven't heard about those, please visit our website. We have a full list of all the live seminars as well as the Mastering Medicare online series that we're going to be putting on beginning actually on the 15th of this month. So that's going to be great. Also, if you haven't yet, please like this video. We really need your support. The likes help us out. It doesn't cost anything. It's a little thumb down below. And so please hit that like button if this video was helpful for you. Also, please subscribe to the channel if you see that this information was helpful and you'd like more information about the doctors, the facilities, the other Medicare topics that we have coming up. So thank you so much for watching, and please tune into our next Hello Health presentation.